Today I'm going to be presenting my patient Kaylee, who has low dexterity in type 2 embrasure spaces. This is a result of previous gum disease and dental implants. After completing her routine cleaning, I noticed that she has deeper probing depths and mild gingival bleeding. As such, I believe that she would benefit from utilizing interdental brushes in her daily routine for improved oral health. Previous research and case analysis have revealed that interdental brushes are ideal for this type of oral condition. This is due to the fact that plaque and oral biofilm are removed more easily through the use of interdental brushes, especially when compared to dental floss. In regular type 2 embrasures, the spaces are too large and regular flossing is no longer able to reach the target areas. Toothbrushing alone is ineffective in cleaning the interdental spaces and instead is used to remove biofilm from the occlusal, lingual, and buccal surfaces of the teeth. If oral biofilm is left undisturbed, this may lead to the formation of gingivitis and calculus, which could progress to periodontitis if not addressed early on. As such, it is necessary for dental hygienists to create an individualized care plan to demonstrate proper oral hygiene techniques to the patient in every appointment. The care plan is created following the process of care, which includes the initial assessment, diagnosis, planning, implementation, evaluation, and documentation stages. Each care plan should be approached in a manner specific to the patient's needs and diagnosis. Additionally, oral hygiene instruction is integral to the implementation phase of the carefully constructed care plan. There are many elements that assist in the effectiveness of interdental brushes, most notably the tapered brush design, the thin bendable wire that can be manipulated to reach multiple areas, and the flexible grip handle. How are you doing today? Have you been feeling well? Are there any problem areas that you would like to discuss, or like any pain or sensitivity?
I've been feeling a little bit of sensitivity, and I did just break my wrist like about a month and a half ago, and it's been hard for me to floss recently.
Oh, I'm sorry
I feel
to
like
hear that. After looking over your x-rays and completing your dental examination, I noticed that you also have larger spaces between your teeth, and the gums appear to have slight recession. This is likely due to your previous history of gum disease, which you disclosed to me in a previous time. And the good news is that we can manage this together, and you already have an established flossing routine. For this reason, I want to suggest a device. It's called an interdental brush, and I think that you would greatly benefit from it. I highly recommend that you use it instead of regular floss to remove plaque or any leftover food that might get stuck between your teeth, as you had mentioned. And regular floss has been ineffective lately, and that's probably because of the enlarged spaces that are too wide for the thin floss to fully remove this plaque and residue. I also noticed that there was slight bleeding in your gums during today's appointment, and this would help minimize that in the future to ensure that you maintain healthy gums. You can easily integrate this into your daily routine after eating and brushing your teeth, and this will help you maintain proper oral health. Interdental brushes come in a variety of sizes, so we have these two for me to show you today. This is a thinner one. Let me take off the cap. And this is a moderately sized one. And I would recommend that you use the moderate size since your interdental spaces are a little bit more pronounced. And there are no specific brands that I would recommend. Just make sure that they are ADA seal approved. These are the GUM brand if you would like to purchase those. I'm going to quickly show you the interdental brush and demonstrate how to use it on a model, and then I'm going to have you quickly demonstrate it for me just to make sure that you fully understand how to use it. How does that sound?
great.
Okay, perfect. So using this moderately sized interdental brush, I'm going to explain how to use it in a few easy steps. First, you're going to slide the brush in between the teeth gently and push it all the way through. Then you're going to go back and forth the full length of the space, making sure to keep light pressure and avoid stabbing the gums to prevent inflammation or trauma to the region. If you're having trouble sliding it through the space, then you can try using a thinner brush, like so, for tighter gum contours. Just make sure to never force it in to avoid trauma like I previously explained. And you're going to repeat this for the rest of the spaces, ensuring to rinse the brush in between uses to avoid introducing bacteria from one space to the next. This might be best to do near a sink. When it comes to these back molars, make sure to do it in two directions, so from outside in as well as inside out, like so. Basically from the cheek side as well as the lingual side. And if you need to, you can also bend the brush so that you can manipulate it into these spaces easier, like so. Making sure to keep gentle force. And you're gonna repeat that for all of the teeth. Like so. Like so. And then we're going to repeat this for the top teeth as well. Getting in those back molars from both directions. Like so. And this will remove any debris or bacteria that you have inside these spaces. Doing this after eating would be greatly beneficial. You can keep using these brushes until the filaments start to fray or look worn out, and this might range from a few days to even a week. Just make sure to rinse them out and store them in a dry container. They do come with a cap, so you can just add the cap back on and continue using them. And now I'm going to have you demonstrate for me how you would do it.
Okay, so I go from the front.
Perfect.
And then on the molars, you said that I have to go from the cheek side and then
From the back side as well. Yeah, just make sure to get those two directions so that you're getting all of that plaque out. That's perfect.
thank you.
All right, so did you have any further questions or did you need me to clarify any points?
No, I think I'm good. I really like the product.
Okay, and you're willing to implement this into your daily routine? All right, perfect. Well, you have a great day and I will see you at your follow-up appointment.
Okay, thank you.